Well, welcome everyone. Thank you for joining our webinar today. My name is Sophie Teague and I'm the Senior Marketing Manager for Public Health here at Jones & Bartlett Learning. And I'm here today with Dr. Richard Riegelman. He's dialing in from Washington, D.C., and he's going to be speaking to us today about the current status of undergraduate public health in the United States. The formal part of the presentation is about 25 minutes, and following that, we'll have a live question and answer session. So now let me introduce you to our featured speaker, Richard Riegelman. Richard Riegelman is Professor of Epidemiology-Biostatistics and Medicine and founding Dean of the George Washington University Milken Institute School of Public Health, where he led the development of the school's undergraduate major in public health, which has been offered since 2003. He's been a leader in undergraduate public health education for over 15 years, working with national organizations, including the Association of Schools and Programs in Public Health, the Association of American Colleges and Universities, and the League for Innovation in the Community College. This year, he was named the recipient of the 2018 Welch Rose Award for Distinguished Service to Academic Public Health. The Welch Rose Award recognizes the highest standards in academic public health and honors individuals who have made a lasting impact on academic public health. Dr. Riegelman is also the editor of the Jones & Bartlett Learning Essential Public Health series, which includes over 20 textbooks designed for undergraduate public health studies. And he is personally the author of Public Health 101, which is the core text in the Essential Public series. And by the way, Public Health 101 just last week published in a new 3rd edition. So with that, I'm going to now hand things over to Dr. Riegelman.
Thank you very much, Sophie. Let's start by talking a little bit about the exponential growth that's been occurring in undergraduate public health education. We have some pretty solid data from the Department of Education. Unfortunately, it's not quite up to date, but it will be updated in June of 2017. But you can see on your screen that in the 1990s, it was a very small activity, undergraduate public health, and the growth has been really quite rapid, and we expect that to continue. There's no, at this point, we don't see the slowdown occurring, though it has to occur at some point. We also have some estimates from the Association of Schools and Programs of Public Health last week at their undergraduate summit, Undergraduate Public Health and Global Health Summit. It was announced that they are now estimating that there are 650 programs in public health in four-year colleges and universities. That includes both the majors and the growing number of minors that are out there. This data is, I think, gives you a graphic display of just how rapid that growth has been in recent years, and it also illustrates that both general public health and global health are very big areas, as well as health education. Those are the two biggest areas in terms of programs. It also is encouraging to see that this is not a local phenomena. You'll see that the stars on this figure are all over the country, very much in proportion to where the people are. And I think that's encouraging that this is truly a national movement. So let's talk a little bit about what this growth means. First of all, bachelor's degrees are continuing to grow, and they will soon rival the number of master's degrees, perhaps. Hard to tell exactly what the future brings, but the 16,000 master's degrees that are granted each year, the undergraduates are catching up. Over half, another important thing for you to understand, if you haven't already, is that over half of the bachelor's degrees are granted by colleges and universities that do not have graduate education in public health. That's truly a new phenomenon, and the schools and programs remain very important places for undergraduate public health, but they are now in the minority. I think it's helpful to think about the growth in undergraduate public health and in public health education as occurring in two different ways. One we'll call lateral growth to nursing, pharmacy, medicine, and health administration and other areas, and the other vertical growth to community colleges, which are now becoming part of it. So the lateral growth includes efforts to include both general education as well as, specialty curriculum, and includes nurses and other clinical and administrative health professionals. The vertical growth includes community colleges, both in general education, which has enormous potential, but also in a small but growing number of associate degrees and certificate programs. So let's talk about first what's been going on in the four-year colleges and in general and specialized education. First of all, in general education, at both 2- and 4-year colleges, there's increasingly public health-related courses that are focused on public health as part of general education. And for a long time, there have been a large number of health and wellness courses, but most of those have been about individual health. What's beginning to change is that it's not just about personal health, it's also a population perspective. And I think that's going to be an area that you're going to see enormous impact, because the vast majority of colleges offer this kinds of course for their usually freshmen, and they're usually part of general education, and it offers an opportunity to tweak existing courses and have them have a much more population perspective. And I think the students are ready for that and the faculty are ready for that. Then there is the overview course. It might be a public health course, it might be a global health course that really provides kind of an introduction to public health and can be often credited toward a major or minor. And finally, health communications, which is not only important to public health, but clearly important to almost all of the health professions. And I think these three courses together are really beginning to form what we're going to be calling the health foundations courses as we apply, and particularly that name is being used at the community college level. So you'll see, I think general education is kind of a new area for growth. Then public health has now, I think, begun to have an impact on clinical teaching, both particularly in nursing and medicine, but also in physician's assistants and pharmacy and a number of other professions. There is increased integration of public health into nursing, as we're going to discuss, both at the traditional approach in nursing, the community health, which I think is undergoing a resurgence, but also the concept of population health, ways to connect the clinical and the public health. So I think the interest in the clinical community, nurses and others, is growing very rapidly. In addition, things have changed for pre-med education. Starting in 2015, the MCAT exam has included two important areas that are very much part of public health education. One is some basic course material on study design and statistics. And so that there is potential for students to be interested in epidemiology courses as the basis for getting sometimes statistics courses, biostatistics courses, the basis for understanding these concepts. But in addition, the health behavior component of the MCAT is the behavioral and social sciences are now a full component of the MCATs and provide great opportunities for enrolling pre-med students. So both at the both nursing and other health professions, as well as medicine, is beginning to see public health as a part of their basic education and their pre-med and pre-nursing education. Community colleges is an area where you're going to see what I would call vertical growth, where there is both where community colleges will be offering and is beginning to offer courses in public health, but also articulating them to bachelor's degree programs, so that it's going to become quite important as community colleges grow their interest that be connected to the bachelor's degree and the national organizations. So I'm going to tell you a little bit about what's been happening in that whole arena. This all began in earnest as part of the ASPPH Framing the Future movement, which ran from 2012 to 2015 and was aimed at celebrating the 100th anniversary of public health education in 2015, but also looking ahead and developing a framework for public health education in the second century. And what is very encouraging is both four-year colleges and two-year colleges were very much a part of that. In fact, there is a whole report that Association of Schools and Programs of Public Health, plus the League for Innovation in the Community College put together, and it is called the Community College and Public Health Report. And that report is available, as Sophie will tell you about, on the websites, but also on the League for Innovation in the Community College website. So in that report, there was recommendations for the development of core courses, of foundational courses, the health foundation courses that we're going to refer to, but there was also the inclusion of associate degree programs in health education, in environmental health, in as well as in health administration and health navigation. So there was an effort to try to develop associate degree programs that could then, many of them, transfer to bachelor's degree programs. So that report and that effort has been out there since 2015. There is a steady growth of associate degree programs and a network within the community colleges for the development of associate degree programs. But we are beginning to enter a new phase and a new strategy, and that is to really bring together the League for Innovation in the Community Colleges with other public health national organizations. So I want to tell you about what's happening. First of all, the League for Innovation in the Community College, they call themselves the League, is the major academic arm of the community colleges, and they represent well over 800 of the 1,100 community colleges. So they are the organization that has the most influence on the academic academic influence in the community colleges. And the community college student body, for those of you who are not familiar with community college, is really quite striking. They're growing very fast. They now have over 40% of all undergraduates take courses, attend community colleges. And as of this last year, they are now 51% minority. So they are majority minority, and that has a big impact on the potential to diversify the public health student body and eventually the public health workforce. And so there's a great deal of interest in public health now in trying to see what can be done to take advantage and to work with the community colleges to make things really articulate. Those of you who have worked with community colleges in almost any area, articulation is always a difficult issue. So we're trying to develop some strategies to make that possible. And the ASPPH has a rapidly growing network of bachelor's degree programs, now over 250 bachelor's programs, called the ASPPH Undergraduate Public Health and Global Health Network. And this group represents a large number of big programs at bachelor's degree level, and ASPPH is encouraging those groups to work together with the community colleges. And to tie some of the associate degree programs, but also the other activities that are developing at the community colleges with the bachelor's degree program. The concept that the community colleges are using to develop public health is called guided learning pathways. And guided learning pathways is a concept that's increasingly widely used in community colleges to try to provide guidance for entering students into how to enter different fields. And so they are working on efforts to have guided learning pathways to public health, but also guided learning pathways to the health professions. And regardless of whether it's to public health or to the health professions at large, they're utilizing the Health Foundation's framework and the Health Foundation courses. And so let's talk about what we mean by Health Foundations. The ASPPH League report identified 3 courses that are being labeled Health Foundations. One, the personal health with a population perspective. Secondly, an overview of public health. And third, health communications. And these 3 courses are really critical for general education, for articulation with bachelor's degree programs, for preparation for not only public health, but nursing and a wide range of health professions. To make this really happen, the League has now developed a strategy along with ASPPH and the Society for Public Health Education, SOPHE. And in 2019, they're going to have 2 types of activities that really will be kicked off in the next month. One is there will be awards for excellence in public health education for community college programs that put on health foundation courses. So they are specifically targeting community colleges to introduce these 3 courses, whether they're for public health, whether they're for the health professions, or both. Secondly, in 2019, the community colleges with ASPPH and SOPHE are launching an initiative during Public Health Week 2019. That's April 1st to 7th, 2019. And they are, it is going to be aimed at tentatively being called What is Public Health and How to Be Part of It. Because community college students we're finding are where I think bachelor's degree students were 10 to 15 years ago. They were interested, they were inquisitive, and they really didn't quite know exactly what public health was or what the career options were. So the effort here is to put on a large number of programs around the country by students, for students in the community colleges to really be able to engage them in understanding the basics of what public health is and what the career opportunities are. In addition, the League has developed a series of, they have a national meeting. This year it's in Washington next week. The next Sunday starts on March 18th. And it will have activities it'll have a series of workshops and presentations, including a workshop being put on Sunday by ASPPH and SOPHE on what is public health and guided learning pathways. There's also will be workshops being planned for their 2019 meeting, which will be in February, starting February 24th next year in New York City. So there's an awful lot of growth. There's an awful lot of opportunities. And as you start thinking about ways to be involved, I think it's important to know some of the ways to connect with what's going on. So I have for you on this slide 3 different ways to get information and be involved in the national activities that are occurring. First of all, ASPPH, as I indicated, has been very active in this whole area. And each year they are putting on a undergraduate summit, Undergraduate Public Health and Global Health Summit, which occurred last week on the 7th of March. And it will be it's an annual event, and it will occur the first day of the ASPPH national meetings, which next year is March 20th, again in Washington, D.C. They also have developed this undergraduate public health network with over 250 programs, and they meet twice a year. They meet at the ASPPH meeting, and they also meet at the APHA meeting, and they have a quarterly newsletter for members. So that is if you already have or are planning a bachelor's degree program, that's an excellent way to be connected. There's also a listserv by the Association of American Colleges and Universities, which now has over 600 members, and it's a good way to get information and to contribute information to other people. And finally, the League for Innovation of the Community College, which has an excellent website that presents all kinds of information for community colleges, and also recognizes those who've done work in developing their own programs. A new activity that you should know about, that you'll hear more about hopefully in the coming months, is that ASPPH has a new writing and public health program. And this program is geared to both undergraduate and graduate level, quite broad goals, improve educational writing for students, but also for faculty, for research, for professional writing, and for writing for the public. ASPPH conducted a survey of its programs in schools and a needs assessment, and confirmed a very strong sense that there was a need to improve writing. Over 85% of all respondents concurred that there was both need and that it should be a priority for improving both student and faculty writing. The initial activities, there already have been a series of workshops, but there are two activities that will be being developed over the coming months. There will be a writing and public health website as part of the ASPPH website, a toolkit is being proposed, and hopefully it will provide resources for people who want to teach writing and improve writing. A new activity that's connected with this is that public health reports is expected to soon announce a new, what they call, department called On Writing in Public Health. And this will have a broad opportunity for those of you who want to write about writing to have a new source of being able to publish. So keep your eye out in public health reports for the new department on writing and public health reports. The first articles and commentaries have been submitted, and they are strongly encouraging additional submissions. So we hope this will be a long-term effort. So as you think about writing, please keep this in mind. Finally, there are a series of changes that have occurred with the Council on Education for Public Health, CEF, and which, as many of you know, it accredits schools and programs, but also accredits standalone bachelor's degree programs. It has a new requirement for schools and programs that they must have publicly available policies and procedures for evaluating community college courses. We think that will be helpful in the articulation process, and hopefully there will be efforts to try to integrate that kind of articulation into accreditation. Finally, CEF has added to the expectations for undergraduate bachelor's degree programs a series of cross-cutting concepts and experiences. And this is actually quite an extensive list, and it is one of the sources of why it's important, some of the new curriculum that is being developed. There are a whole series of areas that I've referred to that I'd like to just briefly summarize for you that are in need of curriculum development, and we think new published materials. One is the CEF cross-cutting competencies and experiences. A second is to continue to meet the needs of undergraduate programs through the Essential Public Health Series. The Health Foundations, 3 courses that have been identified in the Community College and Public Health Report. And finally, a new concept called primers. And so I'm going to turn things over to Sophie to talk to you about each of these areas that Jones and Bartlett is continuing to develop.
Great, thank you, Dr. Riegelman. So we're going to move into the question and answer portion in just a moment. But first, before we do that, and also as a reminder, if you'd like to ask a question, you can use the question box on the right-hand side of your screen, lower right-hand side of your screen. Just go ahead and type a question in, and I will read it aloud for Dr. Riegelman once we get to that piece. But first, I wanted to just say a few words about the Essential Public Health series from Jones and Bartlett. This is the series that Dr. Riegelman is the editor of. And on screen right now is a snapshot of the website, and I encourage you to take a look at it. It's at www.essentialpublichealth.com. If you click on the movement within this site, there are lots of resources that you can click through to or download. Some of the ones that Dr. Riegelman mentioned earlier in the presentation are available there. You can also browse all the titles and request complimentary review copies if you'd like to consider them for course use. And most of the ones that you see on screen now, these are all relatively new ones or very new ones having just published. And let me actually now take you through some of the titles. First off, some of the cross-cutting concepts and expectations from CEF that Dr. Riegelman mentioned before. There is a title within the series that covers many of those cross-cutting concepts. For example, Essentials of Health, Culture, and Diversity by Mark Edberg covers the cultural proficiency concept. Essentials of Public Health Ethics by Ruth Gare Bernheim covers the ethical decision-making as related to self and society expectation. Research Methods is covered by Epidemiology 101 by Bob Fries, that just published last year. Systems Thinking is covered by the Public Health 101 text that just published last week in a 3rd edition. And then finally, the Leadership, Professionalism, Networking, and Teamwork expectation is covered by Essentials of Leadership and Public Health by Lou Rowitz. We've got a lot of new titles for 2018. Public Health 101, as I mentioned, the 3rd edition just published last week. You'll notice, if you were using the 2nd edition, you'll notice that there's a new subtitle, Improving Community Health. And the new edition, the reason for that is that the new edition puts greater emphasis on community involvement and providing community-based services, including a comprehensive new look at expanding roles for nurses, as well as efforts to address the nursing shortage, and additional case studies that emphasize the evolving roles played by nurses in the healthcare and public health systems. The new edition also covers the opioid epidemic and One Health topics, including antibiotic resistance, climate change, and international health regulations. And there are also new case studies on influenza, aging as a public health issue, health navigation, diabetes, and more. Essentials of Public Health Biology is a new 1st edition, which will introduce your students to basic concepts of cellular biology, immunology, and physiology. And the authors build on these concepts to discuss the biological aspects of important public health problems from communicable diseases and non-communicable diseases, including to aging, nutrition, environmental exposures, and injuries. We also have a new 2nd edition of Essentials of Public Health Preparedness and Emergency Management. This edition takes an all hazards approach to public health preparedness and emergency management, and it provides broad perspectives on local, national, and global threats. The 2nd edition adds new authoritative coverage of the field of emergency management. So the title is actually slightly changed from the 1st edition with this edition of emergency management, and also a new co-author who is a hands-on emergency management professional. Essentials of Environmental Health, which also just published. In fact, all of these titles have published within the last 2 weeks. The Essentials of Environmental Health, now in a 3rd edition, is a comprehensive study of the major topics of the field. It uses a straightforward, non-technical approach. And the author, Bob Fries, has included many examples and illustrations of environmental health issues. The 3rd edition is a thorough update and includes the most recent findings on the Ebola and Zika viruses. And it's also got a new, that has been added to the chapter on zoonotic and vector-borne diseases. One additional text that is not pictured here that's going to be coming out in the fall is the 3rd edition of Essentials of Health Behavior by Mark Edberg. Okay, moving on to what we are calling our Health Foundations titles. And there are 3 titles that carry this Health Foundation's logo. The first is Dr. Riegelman's book, Public Health 101, which just published in the 3rd edition. And then these 2 texts are coming out in the fall. Personal Health, A Population Perspective by Michelle Kiley, Meredith Manns, and Chris Palmado. They're all of the CUNY School of Public Health. And unlike other personal health texts, this book combines information about individual health with a discussion of the context of community and global health to which each individual is inextricably linked. Health Communication, Strategies and Skills for a New Era provides a practical process model for developing a health communication intervention. And the book also explores exposure to media and how it shapes our conceptions of health and illness. So, and as I said, these 3 texts together align with the Guided Learning Pathways to Public Health initiative by the League that Dr. Riegelman referred to earlier. On this next slide, we have some primers that we've published or will be publishing in 2018. And these are short texts designed to be bundled with any other Jones and Bartlett learning text at little or no additional cost. One Health from AIDS to Zika is a single chapter that examines the relationships between human, animal, and ecosystem health. And this can be bundled with any Jones and Bartlett text. It's free, essentially, with as long as you're bundling it with a core text. This published in late 2016. Likewise, the 2018 Annual Health Reform Update, that's also a single chapter that just published late last year. That can be bundled with any JV Learning text at no additional cost to your students. And then finally, Essentials of Health Justice. That one is a little bit longer. It's 7 chapters, roughly 150 pages. That's going to be publishing on April 2nd, next month. And that primer uniquely focuses on the legal, structural, and justice issues underlying health disparities, the adequacy of current safety net programs and legal protections affecting the health of vulnerable populations. Health policy, law, and system design focused on achieving health equity, as well as concrete strategies for bringing about change to promote health justice. And that can be bundled with any Jones and Bartlett text for an additional $13 is the pricing for that one. And then finally, we're going to have some more primers coming up in 2019. Dr. Riegelman is going to be writing a primer on population health, and that's a primer for the health professions. There will also be a primer on the opioid and heroin crisis, also a population health approach. And then finally, climate change and population health. So that's a sneak peek at 2019. Stay tuned for more information about those. All right, great. So at this point, we're going to move into questions. And of course, we welcome your comments as well. If you want to tell us about if you've either launched or are considering launching an undergraduate public health program, you want to give us some comments on that. Or if you have questions for Dr. Riegelman, please use the question box in the right-hand side of your screen, and I will ask your question out loud. And we do have some questions coming in, quite a few questions. First off, Dr. Riegelman, let me ask, you indicated that there is increased interest in public health as a part of nursing education. What types of material have you included on nursing in the 3rd edition of Public Health 101?
Well, as I indicated, nursing is important, is a key part of public health, and has really always had an emphasis on community health, nursing, but now is also broadening that to include a population perspective that allows connections with public health on a mutually beneficial basis, I think. To address the nursing more on the 3rd edition, we've included a whole series of issues. For instance, how the nursing shortage is being addressed, new degrees in nursing that are becoming an important part of the nursing profession, expanded and new roles for nurses, And we've included nursing and the role of nursing in public health in case studies such as influenza and obesity. And as you indicated, the new subtitle, Community Health, Improving Community Health, is very much aimed at trying to incorporate the work that is done by clinical health professions, including nursing.
All right, great, thank you. Here's a question about health education. How do we transition a health education degree to a public health degree? And they're also asking if we have a 101 text for social sciences or health behavior.
Well, first of all, there is the health behavior course, the book that Mark Edberg has written, is coming out in its third edition, is very much aimed at health behavior courses. I think if you're talking about taking a curriculum that is now called health education and moving it to a public health, I think that's a complicated question because it depends on whether they're aiming to do the health educator certification, the CHESS certification. The CHESS certification is one of only two undergraduate certifications, the other being in environmental health. So that I think it very much depends on what the aim is. For those of you who want to be able to have certified health educators, it is important to work with the CHESS examination and the certified health educators. So I'd be glad to exchange emails about that, but it's an important topic, and certainly the CHESS examination and health educators is an important part of undergraduate public health.
Great, thank you. Here's a question, just looking for clarification on something that a data point you had mentioned, Dr. Riegelman, about something that was 51% minorities. Can you clarify what you were referring to?
Yes, the community colleges today are, the majority of community college students are now coming from minority populations in the United States. And that's a change, and it's one of the first, big institutions in this country to become majority minority. And I think that has a great deal of impact for the bachelor's degree programs, a great deal of potential impact for the public health workforce, and has been very well received by the national public health organizations as another reason to work with the community colleges.
Okay, great. Another question about community colleges. Someone is asking, I know several community colleges are offering associate's degrees or certificates in public health, but is there a job market for these degrees?
Most of these degrees are intentionally designed for transfer. Certainly there are lots of community college graduates who are working in health departments and other public health, but the intention of the associate degrees are largely to transfer, to articulate with bachelor's degrees. That's why it's so important that the bachelor's degree program and the community college programs and community colleges in general work together and develop smooth articulation.
Okay, good. Here is someone who is a professor in a medical school, and he or she is curious about how changes could be integrated into the medical school undergraduate training program.
I think that the concept of population health is going to be the framework for doing that. Certainly there are traditional epidemiology courses, sometimes a little bit of statistics and health behavior. There's always been bits and pieces of public health integrated into the medical school curriculum, but it hasn't been done in a very coherent way. And I think the population health framework provides that. You'll note that in our the primers that are now being developed, they're largely focused on population health. Everything from the opioid crisis to the climate change, to One Health are all concepts that are very relevant to medicine, and hopefully will be become integrated into a coherent population health approach in medical schools.
Okay, great, thank you. Here is a question about the health foundations courses that you talked about, specifically the first one you addressed, personal health with a population health perspective. Can you speak to what is driving this new shift to a broader perspective and any recommendations on how to incorporate a population perspective?
Yeah, I think that this is really is a major change that is the result of the enormous growth that's going on in undergraduate. 15 years ago, it just didn't exist. Undergraduate students and even some undergraduate faculty were asking the basic question, what's public health? And those questions are no longer that frequently asked in most four-year colleges. There really is an understanding that health is not just a personal behavior. Health is also a social issue, and that it's an issue that public health is really quite good at addressing, intended to address. And so I think you'll find that population, the interest in broadening the courses that already exist, and there's a lot of them out there that are called personal health, sometimes they're called personal health and wellness, but to broaden those courses to include a public health, a population health perspective is going to be very important, and in some ways not so difficult because the courses already exist, and as textbook become available for this kind of a course, I think you'll see it quite well accepted. There's an awful lot of areas we could discuss, but I think clearly public health has a great deal to offer to introductory health and wellness courses in both four-year and two-year colleges.
Great, thank you, Dr. Riegelman. Here's a question about health literacy. What about health literacy and/or health communications? I teach that and struggle to find a good undergrad text.
Well, that's what the intention of this new text that's coming out in the fall is to provide a basic health communications course that is good preparation for public health, but also good preparation for nursing and medicine and pharmacy and all the other health professions, because no health profession can exist today without good health communications. So we think that it's a core, a foundational skill, and that it's applicable widely to the health professions.
Good, thank you. Let's see, regarding CEIF's new requirements for bachelor's programs in public health to create policy procedures for community colleges. I'm sorry, let me reread that question. Regarding CEIF's new requirement for bachelor's programs in public health to create policy procedures for community college transfer students, when does this new expectation go into effect?
Well, currently it's in the new requirements, 2016 requirements for schools and programs. So it's already in effect for schools and programs. The criteria for standalone programs is still in the development phase, so it's not clear what will be in there yet and when it'll become effective. But it already exists for schools and programs.
Okay, very good, thank you. For a local four-year comprehensive publicly funded college, I've begun developing a new Bachelor of Science in Health Science, specifically for working professionals with an applied associate's degree in health science. Given the trends you shared, should this college instead be developing a Bachelor of Science in Public Health? How should the two academic opportunities in higher education be considered and weighed for prioritization?
Well, it really is, depending on how your institution is structured. We hope that associate degree education and bachelor's degree education will be hardwired. That's a challenge. It's a challenge not just in public health, but in most academic fields. But it's one that I think we've had extremely good collaboration between the League for Innovation at Community Colleges, ASPPH, and SOFI, and I'm optimistic that there will be increasingly good articulation. Community college programs are new, so we still don't have a lot of good models. So if you can do that, hopefully you'll get a lot of visibility.
Okay. The next question is about online programs. What is the status of 100% online undergrad and grad MPH public health programs in the U.S., and what do you think is the direction for 100% online public health programs in the future?
Well, I heard MPH, and there are a lot of online MPH programs. It seems to be actually growing very rapidly. There are a few undergraduate programs, but there's still very few compared to the master's degree programs. I think the community colleges do online education, and there has been some discussion of associate degree programs online. But I would say that at the undergraduate level, online is still a work in progress, and it's not clear what role undergraduate online programs will provide as part of undergraduate. But they are they are permitted, as I understand, through the accreditation process.
Great. Here's a question. I currently teach the structure of the U.S. healthcare delivery system and remain frustrated by how thinly existing texts explain in concrete terms how population health represents an essential bridge between public health and clinical care. Journal articles help, but tend to be very high level, for example, health affairs for undergrads. What do you suggest for my syllabus and course content?
Well, I think this is an important area. It's true that health administration and public health have not necessarily shared population health, but I'm seeing that as something that is about to happen. And we have a new undergraduate administrative book by Dr. James Johnson, which will be coming out in the next cycle of things. And so we hope that will provide some new structures for thinking about population health as an administrative issue, as well as a clinical and public health issue.
Great, thank you. And here's a question I think is more for me. How can we be informed when the 2019 primers are out? This person is particularly interested in the opioid primer. And I would say the best thing to do, you're probably already on our email list, but if not, you can go to the homepage of our website and click the button that says, it's something along the lines of join our email list or receive email updates, and you can select the introductory public health interest, the discipline interest, and you'll get updated as soon as the primer is close to coming out. We'll send you an email update. The next question here, my college has a community health education program and our courses align with the NCHEC competencies. What is the relationship between CEF and public health education and community health education programs? Also, please answer with regard to CHES and CPH certificates. For example, the National Board of Public Health Examiners does not list SOPHE as a member organization.
Okay, well, there's two different sets of issues here. The CEF accreditation now has the option to be for community health education, and that, as I understand it, those are programs that make graduates eligible for the CHES examination. For those of you who aren't familiar with the CHES examination, it is a test that leads to certification in health education and is available at both the bachelor's degree level as well as the master's degree level, so that CEF accreditation is part of that process. The Certify in Public Health is a little different. Certify in Public Health is actually a general public health degree examination designed to cover the core curriculum of master's degrees. And in order to be eligible for certification in public health, there are two ways to do it. One is to be enrolled in a CEPH, a certified, accredited master's degree program, and have completed the core courses. A second way is to be a bachelor's degree graduate with 5 years work experience. The content is public health content, so it's certainly an advantage to be a graduate with bachelor's degree with a public health bachelor's degree, or perhaps a health education bachelor's degree. But the specific degree is not a critical issue. So there are two different processes. One, the a chest examination leading to health education certification, and the Certify in Public Health leading to public health accreditation. They're both considered to be important credentials. They're two separate credentials, however.
Okay. Let's see. Is there an emphasis on drug education and/or sex education moving forward?
Well, I think that is part of the personal health and wellness, and I think that will continue to be. I think that people are appreciating, and the opioid crisis is certainly making that very clear, that it's not all about individual behavior. It's also about what we do as a society, and I think the opioid crisis is bringing that to light, just like for our previous generation, the AIDS epidemic brought to light the importance of public health.
Okay. If someone is asking about the availability of some or all of these texts electronically or in digital format, and yes, actually we do have a platform called Publish, and I'm happy to send out a URL for that. It's, I believe the URL is publish.jblearning.com. You can set up a free account, and what that does is it allows you to pick and choose only the chapters that you want. You can do an entire book or just selected chapters from a book, and you can choose either print output or digital. You can get, you can get it in electronic format. Also, many of our, almost all of our texts are available as ebooks through VitalSource. Here's another question about employment. Do you have employment outcomes for students who have a bachelor's degree in public health?
It's coming. It's required for collecting that data is required for CEF accreditation. So we expect that now we'll have some good data down the line, but it's still pretty anecdotal. Students do go directly into the workforce. But they also go to graduate school in public health, to nursing, pharmacy, dentistry, medicine, law, business, international affairs, and the list goes on and on. So we, I think it's a complicated subject. The good news is they're getting jobs. That all those jobs are not all called public health, and I think that's important when you think about the job market, is that you look at the skills of public health and where they're going to be applied rather than the title of the jobs.
Okay, great. And there's another question here about jobs, which I think you've just answered. The concern is about the future job outlook as the dollars, at least in government public health work, continues to shrink. What is your perspective?
Yeah, I think that's important because it is true that governmental public health has had a hard time, as has all governmental services. But public health jobs are in the nonprofit, the not-for-profit sector. They're in the healthcare delivery system. They're in the corporate sector. They're in consulting firms. The job market expansion with public health skills rather than public health job titles has really been quite strong, and there's every reason to think that it will continue to be.
Okay, great. We actually have quite a few more questions here still coming through. And I will continue to answer, go through as many of these questions as I can. I think we'll probably go, if folks have time, we'll go to 10 minutes beyond the hour. But since it is, it's 2:55 now, I just want to answer a couple of questions people have just about the slides and other resources. And I just want to remind everyone that you will get an email, a follow-up email, roughly an hour after the conclusion of the session, and that will have a number of things in it, including a link to the recording, a link to the slides, and links to some of the other resources that Dr. Riegelman referenced, including a full list of resources, selected publications, the listserv that he mentioned, the ASPPH Undergraduate Network, all of that in a single document. I also encourage, and I'm just going to flip to that slide now. We'll continue to answer questions. I'll just show this slide. The other place where you can gather all these materials is at, we have a faculty lounge, a public health faculty lounge that we've developed. It's on LinkedIn. So if you're on LinkedIn, simply go to this URL, go.jblearning.com/ ASPPH LinkedIn. You can request to join and I'll admit you in, but I'm going to put links to all of those materials, including the recorded webinar, will be posted there. And then finally, you can always reach out to me at my email address here, steag@jblearning.com. Just email me directly and I'm happy to help you out. Also with review copies of any of the titles that we've discussed today. Okay, great. So just getting back to questions, here's another question. Why only nursing and public health? What about other health professions?
Well, no question. I mean, we did talk about medicine, but pharmacy, physician assistants, and others, occupational therapy, and a whole series of express interest. The emphasis on nursing comes from a number of sources. One, in community colleges, where we were talking about the Health Foundations courses, nursing is really a major player. 59% of nurses in this country have graduated from community colleges, according to the league's website. Nursing is when we talk about community colleges, nursing is a major factor, but certainly the whole range of health professions is important when we talk about population health.
Okay. And here's a question. I think you may have already answered this. How do we transition community health to a public health degree?
Well, it depends on what you mean by a community health degree. If we're talking about one that is certified by CEPH, accredited by CEPH, then there are some issues about exactly what meeting the criteria. Community health remains an important title, but it seems to resonate most strongly now in the clinical audiences like nursing. I think that the population health, for instance, is also a term. And public health is certainly a term that is being widely used. So I'd be glad to go back and forth on email with you to understand exactly what you mean by the issues that you're facing in terms of transitioning a community health program.
Great, and actually thank you for mentioning that. Dr. Riegelman is happy to receive emails from you if you have further questions. His email address is here on screen. Here's another question. Is there any thought to integrate sustainable development goals into U.S. public health research and practice? Additionally, do you have any thoughts on integrating experiential learning opportunities for undergraduates who seek real-world public health experiences while in school?
Okay, well, let me try to answer both of the sustainable issues are really very much part of many global health programs and global health introductory courses. Sustainability is a broad concept and it means somewhat different things to different people, but I think it's an important one that can be built in quite easily into both global health and public health. Let's see, the second question related
experiential learning.
Experiential learning, of course. Experiential learning is a requirement of CEPH, of CEF. It's a recommendation for all community college programs. Experiential learning in a service learning mode is really quite widespread in both 2-year and 4-year colleges. I don't think that's being neglected. I think it requires a good deal of resources and a good deal of work to set it up, but it's a critically important part of the undergraduate as well as a graduate public health education.
Great, okay. Lots more questions here. Let's see, what progress and what best practices have evolved to improve articulation of undergraduate and graduate public health education?
Well, that's in some way, graduate and undergraduate.
Articulation of undergraduate and graduate public health education.
Okay, so this is a little different question. We've been talking about community college articulation to 4-year colleges, but it is an important issue, articulation of 4-year degrees to master's degrees. There are a number of strategies, one of which has been very successful is joint programs, either 4-2, or 4-1 or 3-2. Most master's degree programs require 2 years, so we're talking 6 years for bachelor's plus master's, whereas the the articulated joint programs are often can be done in 5 years, so they become quite popular, and I think many schools and programs have those kinds of programs. It's still not quite so clear how coursework that's taken at the undergraduate level can be attributed to when somebody enters a master's degree program. At this point, this is handled on a institution by institution basis. So some institutions allow students to test out of introductory courses, take more advanced courses because of their undergraduate education, but it's hard to give you a general answer to that question because it tends to be a institution by institution decision.
Okay. Here's someone who's specifically asking about the certification in environmental health. What is that?
There is a formal certification that can be done at the bachelor's degree level in environmental health. There's an association called the Association for Academic Programs in Environmental Health. They have a certifying examination. You don't have to have a environmental health undergraduate degree, but it certainly helps. And you can find a lot of information on certification in environmental health on the web.
Okay. Let's see. Are the associate degrees in public health more of an occupational associate's or just a feeder to a bachelor's program?
Well, so far there have been two kinds. The ones that seem to be growing most rapidly are the ones that are as you referred to them as feeders or transfer degrees, as is usually referred to by the community colleges, and they are being developed with the expectation of articulation with a bachelor's degree program. A program that was included in the Community College and Public Health report was been called Health Navigation, or Community Health Worker, and these programs tend to be associate degree programs that don't necessarily articulate. These programs have been very tied to the ACA, and with the political issues around the ACA, it's been the community colleges have been slow in adopting these kinds of programs.
Okay, thank you. I have another question here. I work at a university with a graduate public health program, and we are interested in developing an undergraduate program.
Good.
I saw in your online resources that we should avoid a two-class system of graduate and undergraduate education. What does that mean, and how do you recommend avoiding it?
Well, I think there are a number of things that I think people who face these questions have done. One is it's important that the courses are compensated for the faculty the same, that they're given the same kind of scrutiny by curriculum committees, that faculty that undergraduate faculty are valued as highly as graduate faculty. There's a whole variety of things that are institutionally important to be sure that undergraduate isn't kind of a undervalued program. It's increasing number of places. It is a fully integrated into the program, and many faculty teach graduate and undergraduate, and that would be ideal from my perspective.
Okay, and here's a question that could be related. Students graduating into MPH and MSPH programs are reporting that they're not challenged by the program as they have covered much of the core domain materials as undergraduates. Is there discussion on how MPH programs will be changing to prepare for undergraduate students with BS or BA public health degrees?
Yes, that's an important issue. I think 10 years ago that was certainly the norm, is that people came into master's degree programs with little or no background in the skills of public health, and they had to really start at the beginning. So I think, from my perspective, good news is that the master's degree programs are being challenged to provide additional, more advanced training for master's degree students. And one of the things that's certainly happening at the MPH level is that specialization is becoming the norm. And that does allow for people to be able to reach a quite high level of proficiency in MPH programs. But I think that's really one of the accomplishments of the undergraduate movement, is that it has stimulated change in the master's degree program as well.
Okay, great, thank you. Here's another question about environmental health, but at the graduate level. What is happening with regard to positioning environmental health at the graduate level? I know of collaborations between environmental scientists and public health towards joint degrees, for example, to address drinking water and sanitation. Is CEF moving away from environmental health as part of the core in general public health practice?
I certainly haven't heard any evidence that CEF is moving away from environmental health. It remains a critical part of public health. It is true that the student body in environmental health and in occupational health has often been smaller than other departments or other specializations. So I think there is a good deal of effort to try to understand how environmental health can be positioned for the future to attract students who are interested not only in science, but in social science and policy and other areas. So yes, that area is going through some changes, but it's certainly not being ignored.
Okay, very good. And I think we might be getting to the end of the questions here. Let me just review. Here's one question that I can answer with regards to inclusive access. And the question is JBL moving to expand capabilities of inclusive access for digital access to text and related resources? And the answer is yes. We are expanding our capabilities there. We are part of inclusive access. This is something that I can follow up on and get you more information about. I'm actually not the expert here at Jones & Bartlett on inclusive access, but we do have someone who is an expert on that. But the short answer is yes. Let's see. Why are so many public health departments generalist? I think that question, I think I've read that right.
Say that again?
Why are, well, maybe not, why are so many public health departments generalists?
Well, if the question is why are so many people who in practice generalists, I think that that may in part be a reflection of the way education has been in the past. The MPH degree for many years was more of a generalist degree. Today, it's increasingly a specialty degree. So you get an MPH with the emphasis on epidemiology or administration or policy, environmental health. And I think that is an important trend, and so that generalists probably aren't going to be the dominant professional in public health in the future, as they have been largely in the past.
Okay. Let's see. Oh, here's a question about the personal health course as part of the Health Foundations. Can you give an example of personal health with a population perspective?
Well, I think the opioid crisis provides a great example of that. Certainly, the ultimate action is taken at the individual level, but we're seeing an enormous number of influences, everything from the availability of drugs to the attitudes toward prescribing, to the community network for helping people, rehabilitation, the availability of services under the ACA, all kinds of social implications that have contributed to the opioid crisis. To see it exclusively as one person taking drugs is a very narrow perspective on it, and it's not likely to be one that's going to help us deal with what has really become quite catastrophic situation.
Okay, great. Well, we're right at 3:10, and I'm reviewing the questions here, and I think we have answered everything. There are other questions that look like we've already answered. So if you feel like we haven't answered your question, please feel free to reach out to either one of us. If it's about getting a copy of the slides or any of the texts that we discussed today, that would be to me. And if you have any questions about undergraduate public health in general, Dr. Riegelman is happy to receive your questions. You can feel free to reach out to him directly at his email address listed here on screen, rriegelman@gmail.com. And again, I encourage you to go to our LinkedIn Public Health Faculty Lounge. And this is a place where you can download or click through to see the recording on YouTube. That it does take a few hours to process, but I will be posting it there, as well as links to the other resources. You can also continue the conversation on the Faculty Lounge page and give us your comments or any additional questions to start a conversation. So I think with that, thank you very much to everyone who's joined us today. Thank you, a very special thank you to you, Dr. Riegelman, for your presentation.
My pleasure.
And with that, I'm going to go ahead and close out the session.
Thank you.